Welcome to this explainer. Today, we're jumping straight into a deeply sensitive, yet absolutely vital topic. We're going to talk about the essential role of psychological care in fertility treatments and assisted reproductive technology, or ART for short. To kick things off, let's just take a second to acknowledge the very real, profound emotional weight of this journey. When we talk about infertility, we aren't just looking at a medical diagnosis. We are talking about a human experience that triggers chronic grief, intense stress, and a really heavy sense of hopelessness, especially when treatments don't work out. Section 1, the emotional toll of ART. Before we can talk about the solutions, we have to fully understand the impact. Now, this emotional burden isn't just some minor side effect you can brush off. Infertility triggers intense stress. And here's the crucial part. Each unsuccessful cycle is experienced by the patient as a profound, significant loss. It's not a medical setback, it's a grieving process. And because of that, there's a huge need for immediate, effective coping strategies to help patients keep their hope alive. Section 2, 3 pillars of counseling. Let's look at how clinics actually build a structured safety net for these patients. So what exactly is fertility counseling? Well, it's a highly specialized form of talk therapy. It's this dedicated psychotherapeutic interaction designed specifically for the unique pain points of struggling to achieve parenthood. It's all about guiding clients through incredibly tough medical decisions while helping them process some seriously complex emotions. We generally break this down into 3 specific pillars of care. Pillar 1 is information, or implication counseling. This first pillar, it is all about clarity. It's there to help couples navigate what is honestly an overwhelming legal and ethical labyrinth. From detailing complex treatment options to figuring out the future of embryo storage, donation, or surrogacy, this pillar ensures patients fully grasp the massive implications of their choices before making them. Moving on, Pillar 2 is support counseling. Think of this one as an immediate emotional life raft. It's designed to activate exactly when stress peaks, most notably right after an unsuccessful treatment cycle. It provides a safe, highly empathetic space for couples to just express what they're feeling and find some comfort when the whole process feels completely unbearable. And the final pillar is therapeutic counseling. While the second pillar is about acute crisis, this third approach is for the long haul. It's focused on lasting resilience and healing. The intense pressure of ART can seriously strain relationships, right? So this pillar works to resolve marital conflicts born from that chronic stress. Plus, it gently helps individuals explore alternative paths to fulfillment if traditional treatments aren't succeeding. Section 3, support after unsuccessful cycles. This brings us to perhaps the most vulnerable moment of the entire journey. Have a look at this timeline because this is the absolute gold standard of care. It follows a strict, immediate protocol. By performing pregnancy tests at hour 0 right there in the clinic, patients instantly transition into a supportive environment rather than getting devastating news all alone at home. By hour 1, nurses are there providing emotional support. By week 1, the doctor reviews the cycle and outlines future options. It's a continuous, unbroken chain of care. Section 4, the care team approach. Providing this level of prompt support is a huge job, and it cannot fall on just one person. Teamwork is an absolute necessity here. Nurses serve as that vital first point of contact, checking in on well-being. Then, doctors review the medical side of things. Finally, trained counselors step in to provide that deep, confidential emotional processing. Having clear referral pathways between these 3 groups literally makes or breaks the patient experience. Section 5, beyond the clinic. Because as we know, healing definitely doesn't stop at the clinic doors. We are actually seeing a fascinating shift in contemporary practice when it comes to external support. Obviously, patient support groups are incredible for reducing feelings of isolation through shared experiences. But alongside that, medical professionals are now heavily recognizing spirituality and belief as a deeply powerful, valid source of comfort. In the past, clinical teaching sometimes discouraged bringing spirituality into counseling, but today, we understand that a patient's beliefs can be an essential anchor on their hardest days. Section 6, integrating psychological care. Let's address the systemic necessity of all this. Despite everything we've just talked about, here is the harsh systemic gap. access to these vital services remains wildly inconsistent around the world. Not all couples seek it out, and frankly, a lot of them are never even offered it. But the data is undeniable. Professional guidelines recommend standard integration because bringing psychological care into the fold dramatically improves both patient well-being and their adherence to treatment. Basically, when the mind is supported, the medical process just works better. To wrap up this explainer, I want to leave you with a provocative question. If the heartbreak of infertility is universal, shouldn't the emotional care we provide be universal as well? By prioritizing these pillars of counseling, we can actually ensure that no one has to walk the difficult path of ART alone. Thank you so much for joining me today to explore this really important topic.